Welcome, everyone. I'm Molly Robdino, the project coordinator for the California Evidence-Based Clearinghouse for Child Welfare, or CEBC for short. I'd like to thank you all for joining us and welcome you to the webinar. We want to give a friendly reminder to mute your phones if you are on the telephone right now. If you're experiencing any technical difficulties or have any urgent questions, please use the Q&A pod located on the bottom of the screen, and we will do our best to assist you. We will also have a brief Q&A section at the end of the webinar. Please use your Q&A pod to send us your questions. Please also find the PDFs of the webinar PowerPoint slides at the bottom of the screen in front of you. Lastly, you will receive an email after the conclusion of this webinar with a link to complete a short and easy survey so we can continue to improve our webinars and make them as useful and beneficial as possible in the future. And now I'm going to go ahead and turn it over to my colleague Jared Martin, who will give a brief introduction of our presenter.
Great. Hello, everyone, and thanks for joining the webinar today. I'm excited to introduce Dr. Palinkas. Dr. Larry Palinkas is the Albert G. and Francis Lomas Fieldman Professor of Social Policy and Health and Chair of the Department of Children, Youth, and Families at the University of Southern California. He also holds secondary appointments as professor in the Departments of Anthropology and Preventative Medicine at USC. A medical anthropologist, Dr. Palinkas is an expert in the areas of preventative medicine, cross-cultural medicine, and health service research. His current research encompasses implementation of child and adolescent mental health services, sustainment of prevention programs and initiatives, and effects of climate change on vulnerable populations. Dr. Palinkas' work has been funded by the National Science Foundation, NASA, National Institute of Health, the MacArthur Foundation, and the William T. Grant Foundation. He is an elected fellow of the American Academy of Social Work and Social Welfare, American Anthropological Association, and Society for Applied Anthropology. Dr. Palinkas is the author of more than 360 publications, and we are excited to have him present this webinar today, and now I will hand it over to him for the talk. Thank you.
I'd like to begin, first of all, by asking you a question about how familiar those of you who are listening in are with prevention programs. If you could just click on the right-hand side or the left-hand side, however it appears on your screen, as to whether you're somewhat familiar, very familiar, not familiar. So as you know, many of the evidence-based practices in the CEBC target treatment of mental or behavioral health problems, but we're equally concerned with the prevention of those problems. So it appears that that most of you fall into the somewhat category, or as you may not know, there are different phases or aspects to implementing any program, whether it targets prevention or targets treatment, whether it's a policy or a series of programs or an individual practice. And generally, many implementation frameworks and models usually identify the end of that process as being one of sustainment. And oftentimes that's considered to be the ongoing maintenance of a program, a continuation of program. Most importantly, once the funding that initially supported the development of the program has come to an end. Unfortunately, when it comes to prevention efforts that target drug and alcohol abuse or HIV or related mental health problems, even though sustaining those efforts is considered one of the greatest challenges to implementation science, it's also perhaps one that we understand the least. And part of the problem is that we have a great deal of controversy or uncertainty as to what exactly the term sustainment or even sustainability means, and what factors predict or even measure sustainability of effective prevention programs and support systems, whether they exist in communities, in tribal entities, states, or the federal environment. One of the agencies, federal agencies, that's tasked with prevention of behavioral and mental health issues is SAMHSA, the Substance Abuse Mental Health Services Administration. Their role is to reduce substance abuse and mental illness, and doing so through promoting behavioral health, an emphasis on prevention as well as treatment, and the realization that as a result of these efforts, people do eventually recover. While many of the services that SAMHSA provides do target treatment, it has a very important emphasis on prevention. And in fact, the acting administrator of SAMHSA has given prevention the #1 priority. And 2 of the 4 SAMHSA agencies, the CSAP, or the Center for Substance Abuse Prevention, and the Center for Mental Health Services, are both deeply interested in prevention. And SAMHSA's vision is to try to integrate prevention activities across the centers in much the same way that the Affordable Care Act is seeking to integrate delivery of primary care, behavioral health, and mental health services. Now, while SAMHSA supports a diverse portfolio of prevention and treatment programs, the study that I'm going to describe to you today focuses on 4 different grant programs targeting substance abuse prevention, suicide prevention, and prevention practices in schools. Each of these programs has a specific set of goals and objectives, and each of them has a different set of approaches to preventing these problems once support from SAMHSA is no longer available. So 2 of those 4 programs are supported through the Center for Substance Abuse Prevention. The Strategic Prevention Frameworks, State Implementation Grants, or SPIF-SIG they're called, the Sober Truth on Prevention of Underage Drinking, which is the latest iteration of the Drug-Free Communities programs. And then 2 of the programs are funded or supported through the Center for Mental Health Services, the Garrett Lee Smith Suicide Prevention Programs and the Prevention Programs in Schools, or PPS. Now, we were funded through the National Institute on Drug Abuse to examine all 4 of these programs simultaneously, because it was thought that in doing so we could determine what is meant by the term sustainment, how we might be able to identify and support unique requirements for improving sustainability for each of those 4 programs, but also to develop a generalizable framework comprised of the core elements or components of sustainability across diverse prevention approaches. And the diversity exists not only within the 4 programs, but among the different grantees funded by each program. So our project had 3 aims. The first, to identify core components and their interrelationships across time for sustainability, to design a measurement system that could be used to monitor and provide feedback to grantees regarding the likelihood that their program was going to be sustained, and then to pilot test the predictability of the sustainment measurement system, as we're calling it, and the feasibility and acceptability of this system to both evaluate as well as improve the likelihood of sustainment. So the project is occurring in 3 phases, and 2 of those 3 involve data collection. In the first phase, which was completed last year, we interviewed 45 representatives who were members of 10 different grantees funded by one of the 4 different SAMHSA-funded programs. And then in the third phase, which we're about ready to initiate, we're going to be collecting data from 140 grantees representing the 4 funded SAMHSA programs. So the next poll question that I'd like to ask you, because it relates to the kinds of questions that we were asking the study participants in the first phase, and that is, what's the first thing that comes to mind when you hear the word sustainment or sustainability? The intent of our asking this question in this particular way is we wanted to essentially establish a free list of responses so that we could not only capture the universe of possible answers to this question, but weight them based on their rank in terms of exactly when they were mentioned by a study participant. So based on the responses that we see here, about 40% of you indicated resources and funding is the first thing that comes to mind, and a little bit more than that, think of capacity and infrastructure as things that come to mind. Let's see here. So we wanted to, essentially as a primary focus on the first phase of the study, look at what people thought of when they heard the term sustainment or sustainability. SAMHSA already has a number of activities underway that are designed to improve the sustainability of the grants that they fund. For many of them, training and support to community coalitions is provided by a national organization known as CADCA. The program officers at SAMHSA work with individual grantees to think about sustainability plans, some of which are mandated by the programs that fund them, others that are strongly encouraged. All grantees at one point or another over the course of the life of the grant, either at the proposal stage or within the first couple of years of funding, are required to submit a sustainability plan. And some grantees who are involved in the Strategic Prevention Framework state implementation grants have a focus of sustainability at the core of that process. So the project that we're conducting at the present time is being done in collaboration with a NIDA-funded advanced center known as CPIM, which stands for the Center for Prevention Implementation Methodology. Henrix Brown at Northwestern University is the PI of this advanced center grant. And for the last 5 years, CPIM has worked very intensively to build a partnership with SAMHSA surrounding these 4 specific programs, the SPIF-SIG, the STOP Act, the Garrett-Lee-Smith, and Prevention Practices in School, as a way of not only building knowledge on sustainability, but using that knowledge to support collaboration across the 4 programs themselves. So it's not just a academic practice or academic federal partnership, but it's designed to facilitate building linkages across the 4 different programs supported by the 2 different SAMHSA centers. The partnership is actually now 5 years old. It's built around the concept of mutual self-interest, and the activities are informed by the needs as identified by SAMHSA, so that the researchers work under the authority and guidance of SAMHSA. So the SPIF-SIG, or Strategic Prevention Framework grants, use the Strategic Prevention Framework, which is essentially an environmental approach to prevention in contrast with individual interactions, which guided many other forms of prevention activities. It's data-driven and outcomes-based, and community-level efforts must include all 5 steps of the Strategic Prevention Framework. At the present time, about 85% of the funds go towards community-level efforts, and the grantees are required to implement an evidence-based program, practice, or policy. The STOP ACT program, on the other hand, was created through a law that was signed by and is under the office of the President and has been in existence since 2005. Its goal is to strengthen collaboration among various sectors of the community to reduce alcohol use among youth, and an awardee under the STOP Act must have been a prior drug-free community or DFC grant recipient. The Garrett Lee Smith program has been around since 2005. The purpose of the program is to develop and implement statewide or tribal suicide prevention strategies through state or citywide collaboration, and a cross-site evaluation as well as a suicide prevention resource center are both supported by SAMHSA, working together to provide assistance in implementing primarily training and screening programs in all of these different settings. So an awardee has to agree to be committed to making suicide prevention a core priority, pair their initiatives with at least one intensive community-based effort, and generally, as I said, that's either training or screening or both. The goals are accomplished through a number of different activities, and the grantees, again, must utilize SAMHSA-supported resources that can facilitate training and screening, and at the present time, about 90% of the grantees implement gatekeeper trainings. The implementing evidence-based prevention practices in schools, or PPS, in contrast to the other three programs, is focused on only one program. It's considered to be a universal evidence-based prevention approach called the Good Behavior Game. The Good Behavior Game has been around for at least 20 years. It's currently used in 21 school districts nationwide, supported through SAMHSA grants. It requires coaching and involves national experts for training and booster sessions. It also requires the assessment of fidelity to the intervention through classroom observations. And in addition to reducing adverse behavioral health outcomes in youth in classroom settings, it's also designed to promote a professional culture of prevention in the classroom. Now, SAMHSA expects grantees to want to continue implementing the Good Behavior Game even though funding may come to an end, that teachers will continue to have some form of coaching available, whether that's through a staff position or a peer group at grade level meetings. Fidelity will continue to be measured periodically, and that there will be a continued existence of supports or partnerships both within school districts as well as between the school district and other organizations and institutions in the community. So getting back to the project that we've been funded through NIDA to conduct. In the first phase, we did telephone interviews or site visits with 10 different grantees, a minimum of 2 grantees supported by each of the 4 programs that I just described to you. Now, these interviews usually involve the PI or director as well as key staff members. In addition, we've been collecting grant proposals, progress reports, and other documents describing the program, and then conducted a web-based survey of coalition social networks. We just completed the second phase of the project, which is to identify data that's already collected by SAMHSA through different automated data collection systems that correspond to the domains and components of the Consolidated Framework for Implementation Research. We identify data relevant to sustainment that's not routinely collected by SAMHSA, and have created a preliminary design to our sustainment measurement system. In the third phase, which we're about to initiate, we're hoping to examine the measurement system's short-term predictability, and by short-term I mean over a one-year period of sustainment in previous cohorts of the 4 SAMHSA programs, evaluate the feasibility and grantee acceptability of converting that information into a format that can be used by program officers to provide feedback that will hopefully allow them to both evaluate and make any adjustments they need to improve their own progress towards sustainment. So I think this is the third and final poll question. In terms of sustaining an evidence base, so we asked you previously what comes to mind when you hear the word sustainment or sustainability. What do you think is the most important of the following to sustaining an evidence-based practice, program, or policy? Is it collaboration, networking, partnerships, the utility of the program, its value to the community, advocacy by leadership and commitment, community buy-in and support, training, or available staff, capacity and infrastructure, or evidence of positive outcomes? So of these, what do you think is the most important? So let's see, things are changing even as we speak. Well, it comes down to leadership, advocacy, and commitment, and staffing, capacity, and infrastructure are considered by the largest percentages of you on the line, and then collaboration, networking, and partnerships. Now, one of the things to keep in mind is the way that individuals, and as I'll show you, respond to this question based on whether they're implementing a single program or policy like the good behavior game, or they're trying to implement a broader strategy like suicide prevention, may have an impact on which of these they consider to be the most important. So let's move on. We asked people during the interviews that we conducted a series of open-ended questions in a semi-structured interview format about their experience with implementing and sustaining the programs that they were responsible for. And we also asked them to identify barriers and facilitators to sustainment. We then asked them to participate in a free list exercise, much like the one that you just participated in, to elicit conceptions about what is meant by the term of sustainment, what elements of their program they wanted to see sustained, and what they thought it would take to sustain those program elements. And then the third component of our interview involved a checklist of the domain elements from the CFR, in which we asked them with respect to each element which and how important they considered that particular element to be to sustaining their program or practice. With respect to the semi-structured interview, we conducted a grounded theory approach where we coded 3 levels of responses using the deduced qualitative software. We compared coding across different coders and achieved 91% agreement in the use of those codes. We then compared the codes through a process of constant comparison in which we began to group codes into larger categories or groups, and then looked at the association between those groups and the four programs funded as well as the pace of adoption in the implementation of their programs. The free list information that we collected, we subjected to frequency counts, again using constant comparison to create larger units or categories of responses to those free lists. And then we rank ordered the free list by the total nominations of the top 10 that were named. With respect to the checklist of domains from the CFR, we looked at the percent of informants that cited a domain as being of high importance or very high importance. We also created a mean domain score from 0 to 3, where we assessed whether or not they were important and how important they might have been. So I don't particularly want you to read this entire slide, but this kind of gives you an idea of the different themes and sub-themes that were extracted from our semi-structured interview questions. So we, in conducting these interviews, we came up with two primary themes. The first being requirements for sustainment or sustainability. And 1, 2, 3, 4, 5, 6, 7, 8 sub-themes. So funding is certainly a requirement. Consistency with the organizational culture of the grantee and or grantees, the evidence of positive outcomes, the existence of a system for evaluating or monitoring progress and fidelity, the availability of a plan or existence of a plan, the presence of a champion or advocate for the program or practice, the existence of infrastructure capacity, and finally the institutionalization of the program, the routine use. The second theme had to do with indicators of sustainment. So how do you know a program is being sustained, essentially? And that in turn had 5 sub-themes, including institutional support, the presence of ongoing funding or a source of ongoing funding, community support and buy-in, the presence and continued operation of a coalition or collaboration, and a ongoing program, even though that program usually had different characteristics depending upon the SAMHSA program funding that grant. With respect to the free list, when we looked at the number of nominations of terms or concepts that came to mind when people thought of when they heard the term sustainment or sustainability, the most frequent response was funding, followed by partnership, the existence of capacity or infrastructure, a coalition, continuity, positive outcomes, the utility of the program to the community or value, continued support, availability of resources, a plan or a continued program for evaluation, monitoring, and data collection, and then continued community support. When we asked them what should be sustained, the most frequent response were program-specific activities. So individuals who were funded through the Garrett Lee Smith, for instance, every one of them talked about training or screening for suicide. That was less of a concern in the good behavior game. It was a primary concern in the Stop Act activities. The second most frequently cited was training. You can see the good behavior game had the highest, given its emphasis on coaching and external experts. The continued existence of the coalition was most frequently cited by the state prevention framework grants, and that's because they rely more so than the other programs on a coalition as the basis for funding of their grant activities. And then other things that people wanted to continued support for included evaluation and monitoring, integration with other programs, funding, media campaign partnerships, and positive outcomes. And then finally, with respect to what it would take to sustain these programs, the most frequently cited was funding, followed by a collaboration or networking partnership, leadership, support, and commitment, community buy-in, training, capacity, infrastructure, staffing, positive outcomes, and utility, translation, and value. Now, one of the things that you'll notice, and I'll talk about later, is that many of these terms come up in more than one of those three free lists, so that oftentimes when people think about what sustainment means, they think about what's required to sustain a program, or what is required oftentimes appears in response to what it is about your program that you want to see sustained. With respect to the CFR domains, just focusing on those that were endorsed by 76 to 100% of the participants in the 4 programs, you can see that a couple of elements of the intervention or program itself, the strength and quality of evidence supporting that approach, the ability to adapt the program to meet one's needs, a couple of elements of the outer setting or external environment, including needs and resources of the population being served, and the degree to which an organization is networked with other organizations. And the extent to which these were endorsed across the 4 programs were fairly similar. There were no statistically significant differences there. With respect to the inner setting or organizational environment, we found a couple of differences across programs, including perception of the current situation as intolerable or needing change. That was less of an issue with the STOP Act than it was with the Strategic Prevention Framework grants. But here too, we saw nature and quality of networks as being important, the perception of the current situation needing change being important, shared perception of program importance, goals and feedback, the presence of a learning climate, readiness for implementation, were all elements of the inner setting that were considered critical to sustainment as well as implementation. And then with respect to characteristics of individuals, the knowledge and beliefs that providers had about the intervention or program was considered to be important, although much more so in 3 of the programs than in the STOP Act program. The self-efficacy of individual providers, and then finally elements of the process. So the existence of opinion leaders in the organization, formally appointed internal implementation leaders, program champions, and evaluation of progress made towards implementation or sustainment. So in looking across those 3 sets of data, the information from the semi-structured interviews, the information from the free list, and then the information from the CFR checklist, we identified 4 common elements in all 3 data sets. The first being ongoing coalitions, collaborations, and networks. The second being an infrastructure and capacity to support sustainment. The third being ongoing evaluation of performance and outcomes, and then finally the availability of funding and resources. So as you can see, some of these resonate with the responses that you provided in the polls, and then some of the things didn't seem to be mentioned as much, like the ongoing evaluation of performance and outcomes. We also identified 5 additional elements by 2 of the 3 data sets, community need being one of them, community buy-in and support, leadership that was supportive of the program, the presence of a champion, and evidence of positive outcomes. We did note some differences in element priorities across the program, so that there were differences with respect to the norms, values, and guiding principles of the organizations and how important they were in sustaining a program. The role of pressure from other states, tribes, or communities, so that in some instances, knowing what was being done in another community or another state was an incentive or pressure to innovate and adopt new programs, whereas in other SAMHSA-funded programs, that was less of an issue or a concern. Perception of the current situation as needing change, as you saw, that was less of an issue in the programs that were supported to stop underage drinking than in programs supported to provide a strategic prevention approach to substance abuse or to prevent suicide or to implement the good behavior game. Knowledge and beliefs about the program, the role of coalitions and networking, and the fact that each SAMHSA program supports different activities that grantees wanted to see sustained. So in the STOP Act program, for instance, the use of the photo voice might be a factor that individuals would want to see continued once funding from SAMHSA ended through the STOP Act program, whereas screening programs might be more of an issue in the Garrett Lee Smith intervention. So the sustainment measurement system that we've developed target those 9 common elements, as well as some of the program-specific elements. But we also learned from this experience that the focus on sustainment includes both the process and the products or outcomes of these programs. So that, for instance, keeping a coalition going was considered a successful indicator of sustainment and a goal of sustainment, whereas in other instances, the coalition was seen as a means to achieve other ends, such as reduction in underage drinking or the use of an environmental approach to prevention. And then finally, we saw overlap between how people define sustainment, what they considered to be necessary to achieve sustainment, as well as the product. So I'm going to stop there and take some questions. Just acknowledge that the project itself was funded through the National Institute on Drug Abuse. As I said, involved a collaboration with SAMHSA, as well as a partnership between myself and colleagues at USC and Henricks Brown and colleagues at Northwestern University through the Center for Prevention Implementation Methodology. So I've got some questions in my presenter notes here. I'll take those first, and then if you have any additional questions, definitely I'll try to answer them as best I can. The first one being, what types of considerations for sustainability should an agency think about when planning to adopt a new evidence-based practice? Well, based on the information that we've collected, those considerations should be a plan at the very outset of implementing the evidence-based practice. So having a strong sense about what the goal of implementation is likely to be and what that goal will look like is important. Certainly an understanding of the resources necessary to sustain a program, including the availability of a stable source of funding, the creation of an infrastructure to continue to support the practice independent of the initial source of funding, the availability of essentially community support externally and leadership support internally are probably the most important considerations that one must have. Now, there are several other factors that are also important to implementation in general, including the organizational culture and climate, the extent to which staff are adequately trained, the availability of resources to support the practice. These are all important, but generally having a sustainment plan, a stable source of funding, internal and external support, the presence of a champion of the practice within an organization or agency, those are perhaps the most key considerations. Second question, do I have any thoughts on how agencies can handle situations where the program is being delivered with fidelity, but the client outcomes are poor? Well, that has a lot to say with the difference between a practice that has been rigorously evaluated under controlled conditions and the challenges of implementing that practice under real-world conditions, so that fidelity as a strategy can be implemented in a very rigorous manner. The practice can be monitored very rigorously, but the inability to establish a fit between the practice itself and the needs of a specific group of clients begins to raise the issue of how much of a need for adapting an intervention is there, and how much adaptation can occur before the practice itself no longer becomes evidence-based or loses its evidence base. Those are decisions that in part are answered through experimentation, but there are also factors that perhaps speak to why so many of the people in our project stress the importance of ongoing evaluation and monitoring, so that linking fidelity to outcomes was considered to be a key element to sustainment in pretty much across all 4 programs. Third, are there any available tools that can assist providers with planning for and monitoring sustainability? So as we indicated, the intention was really to focus on developing a sustainment measurement system as such a tool to assist providers. There currently exist some measures of sustainment or sustainability that people have been using, including the sustainability assessment tool, which was developed by Doug Luke and colleagues at Washington University in St. Louis. The stage of implementation completion screening tool developed developed by Patty Chamberlain and Lisa Saldana, is working on developing and enhancing its use for assessing the last phase of the process of implementation, which is sustainment. And